Hi, I am Dr. Ramakanta Panda, Managing Director of Asian Heart Institute, Mumbai. I grew up in a very small village, remote part of the country where there are no roads. I had to walk almost 7 kilometers a day to get into my school. And in the villages, doctor was the most important person, demigod. So that's what I think inspired me. Plus my uncle was one of the top ENT surgeons, so he was my role model. So as a child, I grew up to become a doctor. And as I took up medicine those days, heart surgery was one of the most exciting, innovating areas in medicine, and that inspired me to dreaming of becoming a cardiac surgeon. I was very lucky to get into All India Institute, do my post-graduation, and from there I was able to go to the best heart center in the world, Cleveland Clinic, where I did my further training. And when I went there, I realized the gap between the best hospitals in the world and our best hospital. In those days, the gap was so much that inspired me to think of coming back to India and do something, and to at least to bring our the standard of healthcare, especially cardiac care in the country, if not to the international, the Cleveland Clinic or the best in the world level, at least near it. And that was the inspiration behind putting up Asian Heart Institute. And I am very happy to say that in 14 years' time, today Asian Heart Institute regarded one of the best, definitely the best heart hospital in the country and one of the best in the world. I think number one focus for us is patient. This is for us, patient is the most important thing, everything else is secondary. Whether it is the quality of care, ethical treatment, we have treated more than 335,000 patients. Not a single patient, nobody can show that we have unnecessary done in treatment or investigation. That is, I think, our most important thing. For us, patient is our God and most important thing. We never do an unethical practice, number one. Number two, we give the best quality care, best results. And our surgical results, operative mortality today is among the top best 2 or 3 in the world, not even in this country. I think that has been the biggest differentiator, is focusing on patient and everything. Everything else is secondary. Marketing to get patients, anything, all secondary. Focusing on patient quality of care and giving the ethical treatment. That is the biggest differentiator. If you look at it, 30 years back when I started getting trained in cardiac surgery, 50% patients to die. Today, the mortality in our center is 0.3% to 0.2% in bypass surgery, 0.6% in other surgeries, which means that 99.7% patients are getting well and going home. In addition to the experience of the doctors, technology has also contributed significantly to this improvement in cardiac care, both in the area of cardiac surgery, in the form of beating heart surgery. We do total arterial, only arterial grafts from inside the chest to do bypass, which works very long time. One of the very few centers in the world doing that, all arterial grafts, to even the non-surgical treatment like angioplasty, where the patients can go home in 2 days, or the newer techniques like TAVR, transcatheter aortic valve replacement, where selected cases the valve replacement can be done without surgery and patient can go home in 2 days. I think the benchmarks in cardiac surgery, most important thing is the mortality, means that means what percentage of patients are dying or what percentage of patients are surviving. The success rate. Number two, the complication rates, like complication like wound infection, patient getting a heart attack, getting a stroke, those kind of complications. I think these are the most important things that to look at benchmarking, and other parameters of quality care. These are all defined, which most today the accredited agencies like Joint Commission International, JCI or NABH in this country, they have laid down a lot of important criteria. One should look at one should follow those criteria as a benchmark for giving the best quality care to the patient. I have done more than 3,700, 800 lost count of cases, I think. The very difficult to point out the most complex cases, but I think some of the complex cases I have done. I start of my career, when I started in Bombay, I did a patient who had stopped. Those days, post-angioplasty complication rate was very high. Heart had stopped for 30 minutes. He had, they are doing massage and everybody refused, it's a dead body. I took up that patient and we operated. The patient was in a coma for 2 months, survived. He's still doing well after 24 years. Starting from that to, if I look another patient, recently we did 5th time valve surgery, where everybody refused. To one patient came from Oman for the 4th time. He had a what is called aortic dissection, which is a very complex surgery. First time he got it done, then there was a complication, then again reoperated, second time he got operation, then he had a 3rd time he went, got stent done, then that failed, then he got another stent done to stop leakage of his leaking ruptured aorta. He came to us. When he come, 5th time the procedure has been done, and he was refused almost all over, not only this country, outside this country, and we operated. He did well and he still doing well 5 years post surgery. We very strongly believe, because we don't anymore believe that doctors are God and they can just tell whatever to the patient. A poor patient has to listen to the doctors and do whatever they want. It is the patient's body, patient's life. They have every right to know what is being done, pros and cons. Also must participate and take decision. Doctors, we as doctors, our role is to help the patient take decision, not force our decision on them. We very strongly believe that. In our hospital, we very strongly practice that. That's, I think, one of the reason also, in spite of mushrooming patient-doctor conflict and patient-doctor malpractice, we have one of the hospital doing, even though we do the highest number of complicated cases, our malpractice or the suing by the patient is one of the lowest. I think that's a very important area where, unfortunately, even though our healthcare, if you see, including cardiac healthcare, is one of the cheapest in the world. It's cheaper than Pakistan and Bangladesh. But unfortunately, because of our standard of living, vast majority of people cannot afford even that much healthcare cost. Number 2, it is not regular healthcare, it is catastrophic healthcare. When suddenly somebody needs a very major procedure where the patient cannot afford and has to sell off everything too. So these are the most important things. I think to tackle that, one, obviously will improving the economic standards. Number 2, providing universal healthcare, or at least those who can afford, they must buy the healthcare insurance. The reason in India, we keep money for everything. We keep money for our house, food, children's education. We never bother about our own health. So I think health should be in the priority list of every Indian, those who can afford to buy health insurance, so that in a catastrophic illnesses you can support, so that you don't become bankrupt. And those who cannot afford, I think it's the duty and responsibility of the government to provide catastrophic, at least if not universal health care, to provide catastrophic health care illnesses for the people who cannot afford. I think I'm very happy and glad that it has been already taken up. Most of the states all over the world, country, they are doing lot of insurance schemes has been initiated by the government, which covers the people below poverty line or those who can't afford with catastrophic health illnesses. For major illnesses like heart surgery, stenting, bypass surgery, cancer surgery, orthopedic surgery is being covered. So I think that's the way to go about it, that those who can afford should buy insurance, and those who cannot afford, government steps in and buys insurance for them. We are planning to expand here. We just purchased 2 additional 2 FSI, 2.5 lakh square feet from the government to expand in this facility. We are hoping to start the construction next few months and do that. We have acquired land in Bhubaneswar. Unfortunately, we have certain problem which got delayed, but within 6 months, finally we got the possession of the land, and we are planning to put up a hospital there, and which will be again focusing more on cardiac cancer and orthopedic illnesses.